My dear friends, Friday again. If you're watching us directly on Truth Be Told Radio Network, every Friday night at 7 p.m. Eastern Standard Time, we are broadcasting this program. But you can listen or watch it, whatever is your preference, the following morning at 9:30 a.m. Eastern Standard Time, if you missed it for any reason, or if you are with the normal current way of doing things, you do it whenever it pleases you to do it, then you go to Spotify and search for Truth Be Told Radio Network, and you can listen to us, you can watch these programs, these broadcasts anytime you want. They're also available on Facebook and Twitter and Instagram, whatever is the social media of your choice. All you have to do is look for me. I am Dr. Rodrigo Rodriguez, Medical Director of BioCare Hospital. And if you look for me, if you look for the hospital, you're going to find a huge number, over 150 programs that deal with what should worry us the most. Being healthy, continue to be healthy, have a long and productive life, but make it enjoyable. You don't want to live many, many years bedridden with tubes around you and oxygen flowing constantly, 24 hours, 7, etc. You want to enjoy life. And enjoyment can only come from health. And that comes in a big proportion from lifestyle. Why is that? Well, it used to be that we lost a lot of lives in the past due to problems like malnutrition. Children died in huge amounts. Mothers died just having a child. And once you were born, your chances of being an adult were really low. Let alone the fact that once you're an adult and you're in good shape, you get something like tuberculosis or leprosy or whatever of those terrible infectious diseases, and you died. We have typhoid. We had, you name it. We had so many infections that were plaguing us that we were really having problems. I cannot tell you exactly the numbers of how many women die just giving birth, let's say 100, 150 years ago. But they were very, very big. And children mortality, even as I was growing up as a doctor, I distinctly remember that we were considering that only 1 out of 2 children could survive the first month after birth. And that was mainly due to nutritional problems, to infectious problems, and so on. Then one day, some magnificent researchers found that we could kill bacteria, that we could kill fungi, and that with that we could conquer infectious diseases. And this goes back to the 1930s when sulfa drugs were discovered. Those of you that are my age will remember distinctly the sulfa drugs, as my mother would give it to us. And when sulfa drugs appeared, things started to change because a lot of the mild infections got under control. But then came the big discovery, penicillin. No wonder that the discoverer of penicillin is buried at Westminster Cathedral. I mean, he deserves it. He deserves that honor. He saved so many lives. Sir Alexander Fleming. He was working in his lab, and then he discovered that one of his cultures had been contaminated with the fungi, and when he looked at the fungi, it is a very common fungus. Very, very common. We find it in the kitchen in every household. We have sometimes left bread in the kitchen, and all of a sudden you look at these little white little threads that develop on this thing. Well, that's exactly the type of fungi that just ruined the cultures this man was doing. But to his surprise, he saw that around that infectious part, that infected part, the bacteria didn't grow. There was a big halo of no growth because that fungus was in there. So instead of discarding them and throwing them away, he started a research that has changed our lives and medicine forever. That discovery was penicillin. And when penicillin came about, we could conquer things like gangrene. At that point in time, we were going through war. And people didn't die because of wounds. They didn't die because of a bullet. They died because of gangrene. Any little thing that happened to them would produce an infectious disease, and that would produce gangrene, which is when your own tissue rottens, and that kills you. Well, penicillin started saving those lives. It was a miracle. And after that miracle, things just started to evolve. We looked for other fungi, we looked for other ways, we looked for other administration routes, we looked for many, many other things, and life was never the same. We never looked back. Today, infectious diseases, we could really say they have been conquered. Because we find a friend and we say, how are you? Fine. And are you going to the wedding? And your friend says, oh, yeah, I'm coming. I went to the doctor. He says I have pneumonia, but he already gave me a pill and feeling better. So tomorrow I'll be fine. Well, not in the very old times. If you had pneumonia, you were risking your life. You could die from it. And you would have to go home and you have to be indoors and you have to take very good care of yourself for a couple of weeks and pray that you would be able to make it. Now it's, no problem. Oh, sure, I got pneumonia, but the doctor gave me a pill, I'm fine. Did you skip work? Did you skip your... No. I went about my life as every day. Then our life expectancy, of course, started to grow. As we conquered these infections that were killing us, to begin from birth, or killing our mothers just for giving birth, and then saving people from... of course, we're not all the time on war, but we were having accidents, we were having infections, we were having wounds, working in the field, etc. And those lives were completely spared. We didn't kill any of those people anymore. So what happened is we started increasing our survival outlook. We would be living longer. And that's what we call life expectancy. If you are born today, how many years do you think I'm going to be by the time I die? And that number has been growing up. That's been growing up steadily for many, many years. Actually, ever since those numbers started to be recorded, they have always increased. We're living longer every day. Up to 2016. And that's before the epidemic. So don't count on the epidemic to blame anything. What happened then? What happened in 2016 is that we started looking at deaths that, as my grandmother would say, happened before time. When you die at your expected age, let's say you talk to somebody and says, oh, Aunt Annie just died. She passed away. Oh my God. Well, she was 92. That says it all. Or, oh, well, yeah, she was old enough, but she had a wonderful life. You die on time. But when you die younger than that, then is when people say she died before his time, before her time. And we started looking at those deaths more frequently. We started to see people that were in their early 70s or 60s or 50s dying. And what is worrisome to me, what is very important to me, is that many of these deaths, many of these diseases could have been prevented. And I don't need Sir Alexander Fleming to discover penicillin. I don't need anybody to help me. I don't even need a drug or a doctor. All I need for you to live longer and healthier, all I need is your will to do it. And that's why I'm gathering with you today. Because I want to tell you about a disease that's probably the most frequent, even though we don't talk about it. We don't talk about it because it's hidden, because we don't see it, but it's eating up us from the inside out. And I want to stop it, mainly because I know you can stop it. All you have to do is be aware, vigilant, and do the things that we're going to talk about. And I promise that on the social media of your choice, you're going to find a list of simple things to do to change it all. Don't go anywhere. We have a lot of things very important to discuss. I hope I have your attention. I hope I have your undivided attention. Because this is a very important message. It's very important information. I was telling you that in the old times when infections ran rampant on the surface of the earth, many people died because of these problems. Gangrene, postpartum fever, tuberculosis, typhoid, salmonellosis, you name it. Those were the killers of the world. Actually, tuberculosis was for over 100 years the number one killer. And you see it in the opera, you see it in novels, you see it in a lot of things, how people died very young, before your time, of this terrible tuberculosis infection. And I was telling you about the discovery of antibiotics. First in Germany with the sulfa drugs, then in England with penicillin. I was telling you that Sir Alexander Fleming is actually buried at Westminster Cathedral. And I think he deserves nothing less. This is a man that changed our lives, changed our lifestyles. We could do a lot more things now, and saved millions and millions, and he still is saving millions of lives every day. But in today's environment, what I see is that up to 2016, our expectancy for life were always going up. If in this year we were expecting to be 72, in 2-3 years our expectancy was 73 and 4, and you name it. we're always expecting to live longer than before. And certainly, this is a very important truth, and you correct me if you think I'm wrong. But I know you won't believe I'm wrong. Certainly, one thing that we always have taken for granted is that I'm going to bury my parents. Because that's the order. They're older than I am. So they're going to very likely die before I die. And when that doesn't happen, it becomes a real tragedy. I mean, when the father has to go to the burial of a child, that must be one of the worst things on earth. My mother used to say that we don't even have a word for it. When you lose your parents, you're an orphan. When you lose your spouse, you're a widow or a widower. How you call somebody that loses a child? We don't even have a word for it. We don't even want to mention it. And what we're coming to is to a very small but gradual descent, lowering of life expectancy in America, beginning in 2016, before the pandemics. So you cannot blame COVID for that one. What happens is that we have been making lifestyle changes, taking advantage of a very resilient, resistant, and very well-made body that God gave us. And you say, oh, I can get away with this, I can get away with that, I can drink, I can smoke, I can party all night. After all, tomorrow morning I'm going to take 3 cups of coffee, or I'm going to take a pill to wake up, or worse, I'm going to go to drugs. Even legal drugs. Many people take legal drugs to help them get away with their problems. And you tell them, well, you have this problem. What are you doing? Oh, I went to the doctor and he gave me a pill. Why? Because we don't care, period. We don't see the problem that's being developing. And I was telling you that we're talking about one of the most frequent disorders in America that nobody sees because it's kind of hidden. And that is fatty liver. You probably have heard the word. You probably have a friend, neighbor, or even yourself who went to the doctor and your doctor says, well, I think you have fatty liver. But in a very nonchalant way. We don't challenge the diagnosis. Oh, okay. And I talk to patients every day, and I talk to friends, and they say they told me I have fatty liver. But I think that's really not important, right? Of course it is important. The liver is the master gland of the body. It does so many, so wonderful things for us that I can't even begin to tell you. But we all know that our liver takes a big part of our abdominal cavity. It's a huge organ because we need each and every cell of that liver to function well. It is like the customs, the police, the garbage, the disposer, the detoxificator, the everything in the body. Just about everything happens in the body is going to go through the liver. Every bite you take, you eat it, it goes to your tummy, it goes to your intestinal, it's absorbed in the bloodstream, and that blood doesn't go to your body. That blood has a special vein that's going to take all the foods being absorbed to the liver. And the liver will sort everything out. Okay, this carbohydrate goes here, this protein goes there, this amino acid, I need it for the brain. this molecule is great. That goes to the heart and starts taking care of everything. Not only that, but if it is need for something, it's going to send it. If there's not need for something, but you may need it in the future, we'll store it somewhere. That's why it's a huge organ. It can keep it somewhere. And then it can change it. Oh my God, I have a lot of this, but I'm losing protein. I'm going to turn this into protein. Or I'm going to turn protein into energy. That can only be made by the liver. And thank God, he gave us a liver. It can do a lot of things. And then detoxifies the body. Every single substance that goes through the liver that shouldn't be there, it's going to be expelled right away. And sometimes those molecules are very difficult to get rid of. Well, have you ever seen that when you send some criminal people, let's say on a plane or something like that, that there's a marshal on their side, and that they put these things in the wrist so he will not run away? Well, that's what the liver does. It takes a toxic substance that doesn't want to leave the body and puts a special protein attached to it, and then gets rid of the protein that, of course, will take that bad guy with it. And it's going to be expelled out of the body. It's the master detoxificator of the body. What would we do without our liver? I'm going to tell you what. You're going to be dead. If your liver gets to a point where it doesn't work that well anymore, then what's going to happen is that you're going to start getting very toxic, very, very toxic. People lose their mind. People don't know where they are. People get very sick. People start getting swollen. People start not getting, they get too much of this, too little of that. It really becomes a tragedy. And every doctor can tell you that when we see a real liver insufficiency, a real liver failure, it's a tragedy. It's a real tragedy how these people go. Just because we don't have a liver. That's how important it is. So, you take care of your liver is going to take care of you. The problem is that being so wonderful, so resilient, so capable of healing, you can do a lot of damage. The liver can take a lot of punishment and still heal back, bounce back, and still heal, that we take it for granted. So you say, oh, I've been drinking this long and nothing has happened. Oh, I've done this, that. I have patients that I have known for years, that I have told them, don't do this, don't do that. Help me with this, help me with that. Don't pay attention. And I have had people that come to me and tell me, doctor, I understand it now. Help me. I'm feeling miserable. I'm doing very bad. I think I'm going to die. I'll do anything you tell me. And sometimes you don't have the courage to say, now it's too late. See, the same way that your liver is resilient and a real healer, it's going to be a day when it gives up. And it goes from white to black. You're kind of hanging in there, holding in there. Everything is just kind of working, but one day your liver quits. And you will know it. And you'll go to the hospital. And you're going to have a lot of tests. And you're going to be bedridden. And you're going to see that they start putting tubes here, tubes there, just to give you life support. Even though everybody knows in that room that you're about to go. So don't wait to that moment. Don't wait to the moment when you say, doctor, I'll do anything you tell me. Call me before that time. Give me a call and say, doctor, I've been doing this. This is like confession. Okay, you go to the priest to tell him you have lied and you will not do it again, etc. Well, talk to me. Send me a mail, follow me, and ask a question. Doctor, I have been doing this. I have been drinking, or I have. What can I do? I don't want to wait to that moment because I know that if I can start making changes today, my liver is going to heal back to normal in 2-3 months. And then I can make plans. I can make plans for my 50th wedding anniversary. I can make plans for my children's graduations. I can make plans for the future because now I have a future. Give me a call. Contact me. Follow me. We have a lot of things to talk about. I am Dr. Rodrigo Rodriguez, Medical Director of BioCare Hospital, and today we're talking about fatty liver. And the reason is because it's a very frequent condition. 1 out of 4 has a fatty liver. Because we have changed our lifestyles, because we have abused a lot of things. And let me put it in perspective, just to show you how well connected all this with our lifestyle. And you're going to say, oh, yes, check. Oh, yeah, check. Oh, yeah, check. I'm going to talk about the conditions that go with fatty liver that they're really concurrent, they really share prevalence, they really are like buddies. And you're going to say, oh, yeah, it makes sense. Makes sense. Which are they? Diabetes, high blood pressure, and obesity, overweight. And then when you think of it, you say, yeah, all of this makes a lot of sense because our lifestyle always goes to those areas. The first symptom we have to be aware, because it's a symptom. Look at it as a symptom. You don't have to go to the doctor to tell you you have this problem. You don't even have to have a balance. All you need is a mirror. All you need is an honest friend or family member that tells you you are gaining weight. All you need is your belt. All you need is to go to buy pants and they tell you, no, you're not 38 anymore. Now you are 42. Those all should be very important warnings. But don't take it nonchalant. Don't say, oh, okay. You have to stop and think. What am I doing? I'm 45. I'm 55. How's everything else? If I have gained 10, 15, 20 pounds, what's happening within? What am I doing to my body? I better go and check my blood sugar. But not only the finger test, because that's a steady picture of where you are right now. It could be higher or lower. It's not going to give you the full picture. No, you have to go to your doctor and say, doctor, I want to make tests that will let me know what are my chances of developing diabetes or sugar metabolic problems. And he's going to do a couple of blood tests, very simple. And he's going to tell you, yes, you are at risk or you are fine. Either way, if you have some risk, you have to do something about it. But even if you're fine, that doesn't mean you can go on. You have to say, God, I thank you. and I promise you I will keep my body that way. Exactly the same way you gave my body to me. I'm going to honor the gift of life by making sure I keep my body in good shape. So either way, the doctor tells you are at risk or you're normal, you can say, okay, I have to do something to return to normality, or thank God, but I'm going to double my effort to make sure it continues to be that way. So it's not that simple as, oh, I'm fine, let's go drinking. Then, when all these metabolic problems arise, and all of them are manifested by obesity, then you know your liver is doing an extra work. And probably, I have said it many times, I don't have anything against anybody being fat. Okay, nothing. I'm not judgmental. I'm not cosmetic oriented. I'm not anything. But when I see a person with overweight or obesity, it tells me story. You look at people like this and you say, what do they eat? How much do they exercise? How much care they take of their bodies? And what kind of toxics they're putting in their lives? Tobacco, alcohol, and write down this one as a common toxic, socially accepted: soda pop. I don't care if it's diet or it's regular. If you're drinking soda pop, you're intoxicating your body one way or another, because it's not the calories. I want you to get that very clearly in your mind. Many people tell me, oh, but I only take soda, diet soda. Okay, let me tell you what. That fools your mouth, because when you drink it, you think it's sweet. Tasty. Good. I hear it all the time. Oh, have you tried this diet soda? It's so good. You don't notice the difference. You don't. Your brain does. Why your brain? Because when we put something in the mouth, we immediately send information to the brain. He's the master. He's the CEO. We have to let them know that you have put something sweet in your mouth. Your tongue, your mouth doesn't know if it's artificial sweetener, sugar, or honey. Doesn't know the difference. It's sweet, and it tells the brain there's sweets in the mouth. So tells the pancreas, get ready, because sugars are coming. And I say sugars because could be many different types of sugars. Sugars are coming your way. So the pancreas starts producing insulin. But you didn't take anything. You just fooled your mouth with the taste, but not your brain. So the brain ordered the pancreas to produce insulin, and the insulin goes to the bloodstream. But where's the sugar? There's no sugar. And here goes again the liver, the poor liver that says, oh my God, we have all this insulin. There's no sugar. That insulin has nothing to do. What am I going to do? That insulin starts turning things in your body into fats. Not only that, but starts depositing those fats in the liver. And it gets a point where the liver has so much fat deposits, fatty liver, that's what we're talking about, that starts sending the fat where? To your abdominal circumference. And that's when you see those love handles growing. That fat shouldn't be there. Sometimes I say, I just saw last week a kid, very slim, very nice guy, strong. He looked very well, and he had a very tight shirt. And I told him, I said, guess you drink a good amount of soda. And he says, yes, but always diet. I said, you see that wheel around your waistline? He said, yeah, I'm going to the gym. I try to get rid of it. I'm having problems with that. I said, that's because of your soda. That's because of your diet soda. So you want to change something very good in your life? Throw it to the garbage can. Some people tell me, I have never tried it, but a lot of people talk about it, that's very good to clean your toilet. Well, use it to clean your toilet. It'll produce no harm in there. But if you drink it, if it's sweet, you're producing a problem. We were meant to drink water. And I almost laugh because two things have happened in my observation. When in Mexico they raised the taxes for soda pop, people said, oh my God, they're raising the taxes for soda pop. What are we going to drink now? Water. Isn't that a simple answer? And the other one, tell me if I'm lying, one of the most difficult things to get when you visit a house or a friend is a glass of water. If somebody tells you what you want to drink and you say a glass of water, they're going to say, oh, but I have coffee. No, I just want a glass of water. I have cold soda pop. No, I just want, what about a beer? They go on and on and on and on until you finally have to open a faucet and drink some water out of the tap because nobody's really going to give you water. I don't know what we have against water, but that's what we should be drinking. That's what God meant us to drink. So every time we drink something else, we're not being obedient. And we're paying the price. Because once again, all these sugary things, and with sugary things I'm going to include in there because it's just sugar, nothing else, white bread, white flour. All of those are very simple sugars that are going to be deposited in the liver in the form of fats. And when those fat deposits are full, then you're going to start creating this big wheel around your waist. So don't let your body suffer this. It is a very small, I could say, sacrifice. It is not, but if you take it that way, it's a very small price to pay for a lot of health. Drink water, only water. Because these fat deposits are going to turn into scar. And scar is going to be replacing the cells of your liver to the point that your liver will no longer be a liver, but will be a mass of scar tissue that has no function. And then things get nasty. Then things get very bad. Then you're going to ask for help. Then you're going to say, I'm willing to give up soda. I'm willing to do this. I'm willing to do that. And even though nobody will tell you, I'm telling you right now, at that point, it's going to be too late. Come back for the next segment. My friends, we have been talking today about fatty liver. And fatty liver is very important because number one is a lot more frequent than what we know. And second, because along with the problem of high blood pressure, it's a silent killer It's very difficult to know you have a problem with your liver. And thirdly, because in big part, the problems of the liver and the answers to the liver depend on you. You're the only one that can make the big change. Not the doctor, not the drug, nothing. Don't let anybody tell you different than that. It is you who can make the big change. You who can prevent the whole problem, and you who can help it and solve it completely. That's why I have this. I feel this is a very dire, important message, because you have in your hand a problem that you can solve without any help, without a doctor, without anybody. So that's why you have to know about it, because the awareness, the vigilance of your liver function and the willingness to help it can make a very healthy you. Live long, be healthy, and enjoy life. You can do it if you are sick. And those of our listeners who have a chronic disease or are bedridden or in a wheelchair and so forth know it very well. Life is never the same when we are sick. And after all this epidemic of COVID, I think many of us became aware of how important is being healthy. I'm Dr. Rodrigo Rodriguez, Medical Director of BioCare Hospital. And I love talking about these things because I feel if I can make a little dent in your lifestyle thinking, I have gained a lot. I might be giving years to your life and better life to your years. So we need to do that, and we can do it together. Of course, liver damage is not necessarily only lifestyle, but it's in the vast majority. We can have malignancies of the liver. We can have infections of the liver, like hepatitis. We have to be aware of that, read about it, be careful about that. But the vast majority of the problems are lifestyle related. And if, let's say, in 90% of the cases, you can make the difference, then it is a very important message. So the question is, doctor, how do I know if I have a problem? Well, this is important because, number one, tell you again, it's not something you can see very clearly. You cannot say, oh, I think my liver is not in good shape. No, it takes blood work. It takes a couple of simple tests. And your doctor can help you with that. You can go to the doctor and you can say, doctor, what is my health, my liver health status at this point? And the doctor might say, what do you want to know? I don't see anything. Well, I know I don't see anything either, but I want to have some proof. Number one, that I'm okay. Number two, if I have a problem, where am I? Because I know I can change it for the better. Now I know better. Now I know that if I take a little control over my life and liver care, I can make wonderful things for my body. So what I would advise you to do is, next time you are in a doctor's visit, ask your doctor. One of the big problems of medicine in the last few decades, and certainly in the time I was, since I became a doctor, is that we always put this barrier between the patient and the doctor. I'm the one that knows. I'm the one that went 4 years to the university, etc., etc. You don't know anything about this. It would take you 4 years in the university to understand it. Of course, that's That's completely false. Number one, you know, and if you don't know, you should know, and you have the right to know. That's the most important thing. You have to start making an inventory of your whole health. You can ask your doctor, how's my heart? How are my lungs? Because when I was a kid, I had pneumonia. I want to know if there's nothing left. I had hepatitis. I want to make sure that my liver is fine, etc. So you can do that, let's say, every 10 years. It's not a lot to ask. You can go to the doctor and have a checkup and check it. The other thing you can do, which is very, very thorough and effective, is an ultrasound scan. Remember that ultrasound do not involve radiation. It's just sound. It's like the sonar of a ship. You send a sound wave, it bounces back, and it bounces back differently when it finds healthy liver than when it finds scar or fat deposits, which is what we're looking for. And not only is important to do it to discover the thing, to be aware, but also because that's going to give me the ability to be vigilant for the future. I'm going to start making the changes, and let's say 6 months, a year, I'm going to repeat it, and I'm going to see, oh, you're doing better. You got it. You're doing better in 6 months. You know that in a year you could be completely fine. What else could be more supportive than having an ultrasound scan where the doctor tells you fat deposits are going down? You see, it doesn't take that much. You don't have to be a doctor. All you need is a doctor that wants to work with you. And if you ask, and if you tell them why, I'm sure you're going to find a good opportunity. Once again, I want to tell you that you can join us, you can follow us, you can ask me any question anytime. People ask me about things like right now, for example, a very common question is, are red hands a symptom of liver disease? Yes, it can be. If you have red palms, look at yourself, see what other symptoms you might have, and look for help. Talk to the doctor. Or send me a mail, call me. We have an 800 line. I'm not going to ask you for anything. I just want to talk to you and talk about your health problems, your health issues, and things that you and I, with the phone, with an email, can start solving. So it's very simple. But I need you to follow me. I need you to be with me. I want you to ask a question. Once we start that communication, you're going to see how easy it is. And I might be able to tell you, why don't you ask your doctor to do this, or why don't you discuss this with him? And then you gradually, but surely, will start taking control of your health. You're going to be an important manager. You're going to have a say-so. You're going to understand more and more your health issues and how to solve them. But the best part is you're going to live longer, healthier. And hopefully you're going to be able to help members of your family. There are situations where liver involvement begins to be serious. That's the time for BioCare. That's the time for you to give us a call and say, the doctor said I have certain involvement with fat deposits in my liver and I'm overweight, I might be diabetic, whatever. This is the time for BioCare. You need a hospital. You need a hospital that understands metabolic processes. And that hospital is BioCare. You give us a call, you come in here. Don't go on vacation this year on a cruise line. Go to BioCare on vacation and eat well and have beautiful meals, but all of them perfectly balanced and in consideration to whatever metabolic problem you have. So you're going to have enjoyment as you get healthier. And you might have oxidative therapies, hyperbaric oxygen, chelation therapy, because many times if you have this sort of a problem, they go hand in hand. You might have fat deposits in your arterial walls, in your heart, or even your brain. So we start to cleanse your body. We can start helping your body to get back to normal. And you're going to notice it. That's the most important thing. By the time you leave the hospital, people always tell me, why didn't I do this before? Why didn't I hear of it before? And they go home very excited because they see that they can control and manage their health in a very positive way. But for that, in some cases, the best thing to do is to check in the hospital, be completely, thoroughly tested, to have your scans for the liver, to know where the liver function is, and how we can start changing it. And before you go home, you're going to see the difference. And when you go home, you will continue to improve. You're going to see how things continue to improve. So all you need is, I'm just a click away. I'm just a phone call away. So don't miss the opportunity. Don't say, I'll do it someday. Do it today. Do it tomorrow morning. Talk about it with your family, with your friends, with your church members or co-workers, and tell them, have you ever thought of this? You see? Particularly those that take soda pop. To me, soda pop at this point is getting to be more of a problem than alcohol, because at least alcohol, you cannot bring it to the office. A diet soda, you can. You can drink it any day, any time, any moment. Nobody is going to judge you. You couldn't go with a beer to your workplace, but you can bring a soda pop. You can buy it there. You can even get it for free at your workplace. And don't do it. Believe me, listen to the advice I'm giving you. Think of you as a wonderful piece of machinery that God produced that needs good care, loving care, BioCare.